A few years ago, the National Alliance for Caregiving estimated that 53 million Americans are caregivers for an adult relative, friend, or even a neighbor with aging or disability or other health condition. Just last month, the RAND Corporation, which is a research institute, estimated that that number has actually grown to 103 million Americans who are supporting a relative, friend, or neighbor with health-related tasks, meal preparation, healthcare coordination, mobility, transportation, and the list goes on. We know that caregivers, based on research, are predominantly female, growing population of sandwich generation caregivers, meaning that they are supporting a child as well as an older or an adult relative. Two other groups I'd like to highlight are young caregivers. So we do have a growing population of young adults and even children who are supporting grandparents and parents, and this was something that really amplified during the pandemic. And then we also have an aging population, which means that we have more older caregivers who are supporting spouses and our oldest relatives, so those in the 85 plus age group. And so these are sort of highlights of growing populations of caregivers. So this is a big part of my work, is looking at how we can better engage family caregivers within the healthcare system. We know that in in-person visits, family caregivers are often accompanying their relative in the clinic, and they are given information, given resources on the spot. But now that we have a new model of care that increasingly uses telehealth, patient portals, online and video-based healthcare visits, we don't really have a good model for how to involve caregivers in that way. And so what happens is caregivers are left with insufficient information. They don't know what their relative has been told or what they are supposed to do. And so when we think about who comprises the healthcare team, we really need to start thinking about where family caregivers fit in and how we can start engaging them within that healthcare team in a formal, standardized, and consistent way across the US, where a lot of these policies and opportunities for engaging caregivers tend to also vary by state, which adds another layer of complexity. So one of the ways that we can engage family caregivers is by reimagining what the healthcare team looks like. So these caregivers have observations, experiences, longitudinal evidence of how their relative functions in the home, what their needs are, what their preferences are. And these caregivers are often actually feeding that information so that clinicians can best support the patient. So one of the groups that I focus on in my research is culturally diverse caregivers. So caregivers from different racial, ethnic, cultural backgrounds who may face things like language barriers or different cultural norms and beliefs in the home versus what they're hearing about in the healthcare setting. And so how do we extend or enhance these policies to be more inclusive for these family caregivers? One emerging area in my research is actually focused on nutrition services. So family caregivers, over half of family caregivers are actually responsible for preparing meals in the home. And oftentimes these special diets are related to chronic conditions that are diet modifiable among their older relatives. However, caregivers aren't typically given a whole lot of information about nutrition or how to prepare those meals. And so in my work, I've heard from caregivers saying that they're basically trying to learn nutrition in a week so that they can better support their relative in the home. Respite care tends to be very much underutilized across the US. And one of the reasons for that is First of all, at the system level, there is a lot of state-level variation in what states offer respite services through Medicaid waivers for caregivers. Many caregivers don't know about what respite care is and how to access those services. If respite services are only offered in English, that becomes inaccessible to caregivers with limited English proficiency. We also have caregivers who may feel guilt or shame associated with leaving their older relative in order to engage in respite services or self-care, whether it's physical activity, getting a good night's sleep, or leaving their relative at a daycare center. And so really changing the conversation around what respite services can look like and the range of those services, and then working to educate caregivers on the benefits associated with respite services can be very helpful.